Assalamualaikum and a very good morning, rise and shine. Hope you have gained something on your previous lecture on carbohydrate. This video adds few information on some misunderstood on carbohydrate perception of which our community might hold. Just a review on some points that have been discussed earlier. Carbohydrate main function serve as energy fuel. Most of the organs such as brain and muscle rely on glucose as their source of energy. Carbohydrate in the form of dietary fiber helps to lower the blood cholesterol through its ability to reduce the amount of bile reabsorbed in the intestine. Furthermore, carbohydrate is also part of the connective tissue such as glycoprotein, hormones, and genetic materials. These are some of the major functions of carbohydrate. Can you find out other functions of carbohydrate? Please be prepared as this will be randomly asked on the next session. Right, back to the taboo or the old said that carbohydrate is the culprit that makes you fat. It is true that calorie intakes play important role in managing your weight. But as you known earlier that the high calorie dense macronutrient is fat, which contribute to 9 kilocalories. But did you know that many food that high in sugar, such as cookies and donuts, are also high in fat? Now, let us highlight the goodness of carbohydrate. Carbohydrate in the form of fiber or starch digests more slowly, which gives you a sense of fullness. Alhamdulillah. Therefore, carbohydrate is actually helping you to curb the hunger. But how? This sub-video will tell you the pathway.
Let me ask you a question. Does this gentleman here look hungry or full? Well, we can't really tell just by looking at his face. We'd have to look at the level of hormones in his bloodstream, because depending on whether this person just ate or not, you'll have a change in the level of hormones that'll then talk to your brain to tell you whether you should eat more food or if you're full. The part of your brain that determines whether you're hungry or not is called the hypothalamus. The hypothalamus. Your hypothalamus helps make the distinction if your body is rich in energy or if your body is poor in energy. Or in other words, are you hungry or are you full? Well, imagine we just ate and the amount of glucose in our blood or the serum or blood concentration of glucose is high. That means we're going to release a hormone called insulin. Insulin is released to store the glucose you have in your blood from whatever meal you just ate, and it'll go and find receptors in the hypothalamus and block these receptors to indicate to the brain and the hypothalamus that you're full, you're not hungry. Now on the flip side, if you have a low blood concentration of glucose, you're not going to be releasing insulin, and so you're not going to be inhibiting the hypothalamus. Now, what if we ate a really fatty meal, and we have high levels of lipids or fat in our bloodstream, something really greasy? Well, that'll cause the release of a hormone called leptin. Leptin is similar to insulin in that it represents the presence of energy-rich nutrients in the bloodstream, so it'll go to the hypothalamus and bind receptors there to inhibit the feeling of hunger, which means that when lipid concentration is low, you're not going to be releasing leptin and you're not going to be inhibiting the hypothalamus. Now the final thing that talks to our brain is our stomachs. After we've eaten a bunch, our stomach will be pretty full with food. However, if we haven't eaten in a while, our stomachs can be pretty empty. And I'm sure you've had this happen to you. If your stomach is empty, it starts talking to you, it starts making noises. It actually starts to growl. And if you listen closely, the stomach is actually saying ghrelin, ghrelin, which just happens to be the name of the hormone that's released into the bloodstream to tell the hypothalamus that we are pretty hungry. We've got a pretty empty stomach. And instead of a bar, I'll put a plus sign here to show that the presence of ghrelin will tell the hypothalamus that we're hungry and motivate us to find some food. These three hormones, insulin, leptin, and ghrelin, are the main players that determine whether we're hungry. One of the interesting things that I should mention, though, about leptin, which I can probably write here, leptin levels rarely change. And the reason why is because leptin levels are based more on the amount of adipose in your body than the amount of lipid you have in your blood. Which makes sense because even though we'll eat some fatty, greasy meal that will release lipids into our bloodstream, we'll definitely have a lot more fat tissue in our body beforehand. So any change in lipid concentration in the blood will be very small relative to how much fat or adipose tissue we have stored in our body.
Right. Carbohydrate plays an important role in fat metabolism. In order for the fat to metabolize and generate ATP, or energy, the fat needs to have the carbon from which can be obtained from the carbohydrate here. Right? Unlikely when the carbohydrate is unavailable, happen if the person is in prolonged starvation or strict carbohydrate diet, the body will form ketones or partially break down fat, and this spare the protein from muscle to be used. Right? The ketone in the body will lead to ketoacidosis if it's accumulate too much, a condition where the blood becomes too acidic and may hinder normal body processes. Right, for the second taboo, have you ever heard that carbohydrate is dangerous for a patient with type 2 diabetes? And this is even a misleading. Okay, you may ask, type 2 diabetes? What is the difference with type 1? Watch this sub-video and please comprehend. You will find the answer.
Diabetes refers to a group of conditions characterized by a high level of blood glucose, commonly referred to as blood sugar. Too much sugar in the blood can cause serious, sometimes life-threatening health problems. There are two types of chronic diabetic conditions: type 1 diabetes and type 2 diabetes. Pregnant women may acquire a transient form of the disease called gestational diabetes, which usually resolves after the birth of the baby. Pre-diabetes is when the blood sugar level is at the borderline, higher than normal, but lower than in diabetics. Pre-diabetes may or may not progress to diabetes. During food digestion, carbohydrates, or carbs, break down into glucose, which is carried by the bloodstream to various organs of the body. Insulin is a hormone produced by beta cells of the pancreas and is necessary for glucose intake by target cells. In healthy people, beta cells of the pancreas produce insulin. Insulin binds to its receptors on target cells and induces glucose intake. In type 1 diabetes, beta cells of the pancreas are destroyed by the immune system by mistake. The reason why this happens is unclear, but genetic factors are believed to play a major role. Insulin production is reduced. Less insulin binds to its receptor on target cells. Less glucose is taken into the cells. More glucose stays in the blood. Type 1 is characterized by early onset. Symptoms commonly start suddenly and before the age of 20. Type 1 diabetes is normally managed with insulin injection. Type 1 diabetics are therefore insulin dependent. In type 2 diabetes, the pancreas produces enough insulin, but something goes wrong either with receptor binding or insulin signaling inside the target cells. The cells are not responsive to insulin, and therefore cannot import glucose. Glucose stays in the blood. In other words, type 2 diabetics are insulin resistant. Here again, genetic factors predispose susceptibility to the disease, but it is believed that lifestyle plays a very important role in type 2. Typically, obesity, inactive lifestyle, and unhealthy diet are associated with higher risk of type 2 diabetes. Type 2 is characterized by adult onset. Symptoms usually appear gradually and start after the age of 30. Type 2 diabetes accounts for about 80 to 90% of all diabetics. Management focuses on weight loss and includes a low-carb diet.
Alright, you should now understand that the type 2 diabetes can be controlled by diet and weight management. But do you know that a total cut of carbohydrate for diabetes patient is dangerous? If your blood sugar drops too low, you can have a low blood sugar reaction called hyperglycemia. Right? A low blood sugar reaction can come on fast. It is caused by taking too much insulin, missing a meal, delaying a meal, exercising too much, or drinking too much alcohol. Sometimes medicine you take for other health problems can cause blood sugar to drop. Therefore, a diabetic patient is encouraged to choose food range from low glycemic index. Glycemic index, or GI, is a number associated with a particular type of food that indicates the food effect on person's blood glucose, or called blood sugar level. The number typically range from 50 to 100, where 100 is equivalent amount of pure glucose. Therefore, it is useful for the diabetic patient to use glycemic index in order to monitor the carbohydrate intake. If you can see in the table here, most of the food from vegetables and fruits have low GI. It can be useful for the patient to opt this food. The next taboo on carbohydrate is more typical that you have always heard. Sugar is making the child going nuisance. The term for a hyperactive child is ADHD, or Attention Deficit Hyperactivity Disorder. ADHD is a neuropsychiatric disorder that is characterized by heightened impulsivity, inattention, and hyperactivity. Most of the research have outlined that genetic from oxidative stress or inflammation is an underlying risk factor for ADHD, although it is actually a complex multifactorial nature that includes environmental factors as well as individual nutritional status. Carbohydrate itself is not a risk factor, but a modulation systematic inflammation through nutrition has potential to decrease ADHD symptoms. There are little evidences suggesting that high sugar consumption is associated with increased ADHD symptoms. Study by Espaham et al. 2014 found out that sucrose consumption was associated with increase in motor activity and was shown to reduce attention in child with ADHD, but not in normal child. On the other hand, if you consume the carbohydrate in moderate amount, you have actually put your brain in relaxing mode. Carbohydrate is associated with mood-boosting brain chemical called serotonin that makes your mood in calm. So opt for healthy carbohydrates such as fruits, vegetables, and legumes. You will note that the calm effect, but your healthy weight as well. Okay, now you have learned few taboos about carbohydrate, and I really hope this helped to shine some light. In order to make your brain more energetic, please answer the following questions. This will be discussed at the next session. I will randomly call the name. Psst, please ensure you have taken your healthy carbo to ensure your brain eats well. The first question, how glycemic index is used? What is the difference between GI and glycemic load? Second, how whole grain food save the environment? The third, sugar and obesity. Does it relate? Good luck and have a nice weekend.